I was drawn to a career in general practice because I've always enjoyed all aspects of medicine and I find it really hard to pick one thing that I like the most. I'm currently doing my advanced school in anaesthetics at RDH. Before this, I've worked firstly doing my emergency certificate here at RDH and 6 months doing a GP placement on the Tiwi Islands in Warramayunga, and then next year I'm planning to do my final year of training in Katherine. So I initially moved to the Territory back in 2009 when I moved to Alice Springs. I was actually a tour guide there, doing trips out to Uluru and the surrounding areas. I fell in love with the Territory then and loved the outdoor lifestyle and the relaxed attitude. It can be challenging when you're going through your training because there's so many things to learn. It's always a challenge balancing family and work life. I have young twins that are about almost 2 years old, so they're quite a handful. I think that knowing that in advance that you're going to have to work quite hard to study for exams and things, and being prepared and organised. I have lots of to-do lists which help me get through all of that. But I think taking the most of every patient encounter you have to learn as much as you can, and studying hard for exams can help to overcome that. I think being a rural and remote GP is particularly rewarding because of the diversity of the job that you get to have. So you can go from a normal GP consult for something like a women's health check to then being called into the resus bay in a remote clinic to help with a sick child, and then going back to doing something else like an abscess drainage. So there's just such a broad spectrum. Being a general practitioner in the Territory can be whatever you want it to be. My dream job will be to work a couple of days in the hospital in a small town so I can do a bit of anaesthetics, and also to work a few days in the community doing general practice.